Have you ever experienced giddiness or a head spinning sensation? Of course, this is a very common symptom and most of you would have felt this sort of head spinning or giddiness sensation somewhere around the life. If yes, this is a video for you and watch the video till the very end. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more and we'll be talking everything about good health and everything good about health. Head spinning or giddiness is a very common symptom and it especially occurs in younger patients post 20 years and can occur up to any extremes of age. But it is frequently correlated with low blood sugars, low blood pressures, or even heart problems and even mental stress. But no doubt these reasons could be a contributing factor to a symptom named giddiness, but the most common reason for this type of giddiness or head spinning is your ears. Your ears are the frequent cause of your giddiness. You'll be surprised to know that ears are associated with two functions, not only hearing but body balance. And the sensations for the hearing and body balance goes together through a nerve called vestibulocochlear nerve towards your brain. Now, if there is a problem in your ears, it is very common to have difficulty in hearing along with giddiness. And sometimes this giddiness is a single factor but might not be associated with the loss of hearing. And this giddiness or head spinning that occurs because of the problem in ears is called BPPV. That means benign paroxysmal positional vertigo. The classical symptoms of these vertigo are a giddiness or head spinning sensation that occurs especially while you move your head sideways or up down. And there is an astonishing elimination of the symptom as soon as you keep your head steady. Also, it is frequently associated with nausea and vomiting, and sometimes it could also be associated with a brief or a mild loss of hearing. That is usually temporary. So coming to the most common reasons or causes of this condition, the first one is a recent infection that includes cough, cold or fever. Usually these are viral throat infections, and these throat infections are frequently associated with the transmission of these infections towards the ear through the eustachian tube, and that is the most common reason of experiencing vertigo. Second most common reason is exposure to cold blowing winds, and the third is seepage of water into the ears while swimming or taking a bath. Now, as I said, this is a very common condition, but most patients panic about it because the sensation of head spinning is that creates anxiety and panic, and it creates a significant worry for your health. The major concern are chances of injuries. Yes, this is the most common thing that happens to patients. They keep their physical activities continued and they don't take adequate rest while they are having vertigo. There are always chances of fall followed by injuries. So the first thing that you have to do is to take complete bed rest if this vertigo starts. And the second most important thing that you have to do is to make a visit to your doctor as soon as you feel a bit stable. Also, you must be accompanied with somebody to take you to a doctor. Don't try to attempt to go alone on a vehicle or by yourself to the doctor. This is the most common thing that we have seen, that these patients start getting anxious and they start moving about, and while making a visit to a doctor for this symptom, they frequently bump into an accident or injure themselves because of the giddiness. So always accompany somebody while making a visit to a doctor, and your doctor will be prescribing anti-vertigo medications for you. These are also a very common set of medications that will improve your vertigo in a matter of minutes, and you'll be fine within 2 to 3 days at the max. Now here the recovery depends on the cause of the vertigo, especially if at all there is a exposure to cold winds or if there is a seepage of water and the vertigo has occurred. You will be better in 2 to 3 days at the max. Infections of the ears might take some more time, but if your vertigo doesn't improve after 5 days, do make a visit to your doctor again and get a scan done. Now this scan includes an MRI scan. So here we need to look for the damage or a problem in your ears, especially the nerve that takes the messages of your body balance and hearing to the nerve we were recently talking about, the vestibulocochlear nerve. So if the vertigo is not responding to medications, it needs to be diagnosed and it needs to be corrected as soon as possible. But as far as BPPV is concerned, that is benign paroxysmal positional vertigo, as the name suggests, it is benign and you are sure to recover within a matter of 2 to 3 days and at the max 5 days. So I'm pretty sure you are all clear about vertigo and what to do and what not to do regarding this condition. I am Dr. Jai Mehta signing up for today from Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time and do take a very good care of yourselves. Bye.